Dr. Lindsey here. In this short video, I'm going to take you through roughly 3,000 graft case, half in the front, half in the crown, on a 40-ish year old fellow with dark hair and relatively light skin. We have an interview, pay particular attention to, we talk about expectation management for the front of the head versus the back of the head. Hi, Dr. Lindsey here. I'm here with Steve, who's 12 and a half months out from his hair transplant, and between us is a picture of Steve's hairline before his surgery, and he didn't have a lot of hair in the two corners and across the front. Steve, I'm just going to pull on your hair. There's hair there. You look unremarkable. You don't look like one of those politicians that we just talked about. What do you think about the front? You can say whatever you want.
Oh, it's good. I think it came out great.
Yeah, you look unremarkable. And
Thanks.
then between us also is a picture of your crown. Turn around and show you the back of your head, please. If I get your face out of there. Okay, you can pick this up. So, Steve's crown is good, but not perfect. And it's not perfect for 4 reasons. One, you can never get a crown perfect unless the guy's gonna have his hair 3 or 4 inches long and layer it, because when you show up on the planet, you have so many hairs here per square inch, and you simply can't pack them that tight, no matter who does it. There has to be some styling and layering. Second is, we can only get so much hair out of you at one time, and we prioritize the front, and we put probably 700 or 800 grafts. Sorry, we put probably 1,500 grafts in the crown, and it could have used 2,200. And third is that the crown will continue to expand a little bit. And fourth, he's got a color contrast. Unlike me, he doesn't have any gray hair. We both have similar colored skin, so there's a color contrast. His scar is difficult to find. In fact, I'd say it's one of my best scars of the year 2024. You can hold this up in front of you and turn back around. Any kind of bullshit that I pulled on you, Steve?
No, well,
And how much pain and suffering do you remember having?
really wasn't bad at all.
Yeah, you just commented to me the thing you were surprised about, and it wasn't that I didn't tell you, was it takes a while for that crown hair to grow in, and so you felt balder for probably 4 months, right? Well, I certainly appreciate your business, and if we can help you again, please let me know. Thank you. So, I think I went through pretty well in the video, but essentially in the front, I'd say on average, we can get a really nice result in the front because of some styling. It's not a comb over, but layering of hairs in the front of your head, like my fingers, makes the illusion that you have as much hair or more hair than you actually have there long before you have a hair transplant, and helps afterwards. In the crown, because most people keep their hair relatively short, I'm now an exception with my longer hair, but all my old pictures, you could see I had a thin area in my crown, but with hair even an inch or so in the back, this layering also allows the illusion that you have lots of hair there. Because recognize that when you showed up on the planet, you got about 100,000 hairs on your head, and no matter how much gold you bring into any doctor's office, there's a finite amount of grafts we can take from back here and move someplace else. And so you have to prioritize and plan to style afterwards. And so in his crown, he really looks quite good. I think that he probably needed a few more grafts, but as I mentioned, we couldn't get more hair out of him safely at that time. And his color contrast, which will fix itself as he gets gray, are things to factor in. So in summary, here's a guy that we did the front and the back at 13 months. It's probably his final result. He's young. I suspect he'll probably have something else done in the middle third of his head, and possibly at that time add a little bit more to his crown. We do plenty of these. There's 560 videos similar to this. Watch a couple of them before you go to anybody's office, including mine. Thanks.